I'm Dr. Rohit Shetty. I'm from Bangalore, Narayana Nethra. I'm a cornea refractive surgeon, and I have an additional role of clinician scientist in eye and eye-related disorders. Today, I'm going to discuss something very new in the domain of eye and what can happen when we go into a heavy misuse of this organ. So when you are seeing me speaking to you, you will see me that I'm not blinking. I'm looking at you. Intent is only on my system, on my work. This is exactly what happens when you're working. The most important thing is we involuntarily or voluntarily stop to blink. See, blinking, minute I speak about blinking, I start blinking more because it goes into a voluntary mode. Why is it important that we blink? It's important we blink because blinking every time brings in a lot of water, and water makes the surface of your eye well lubricated. I mean, you don't need to be a medical person to understand, but any profession in this world, whether it's a mechanic or car mechanic or your computer, if you are not lubricated your instruments well, they don't work. Exactly the same thing. So minute my mind goes into blinking, it starts blinking more. You need to at least blink 12 to 13 times a minute. And one major thing which has happened because of sitting like this on the computer is we stop blinking. We come to 4 or 3. So what really happens is that it induces tremendous amount of stress on the system, which is making it not so conducive for a comfortable being. When I say comfortable, what does it mean? It means that you keep rubbing, you feel tired, and you get headache, and you keep rubbing here. And the whole time, you are always concentrating on something is not right. And at the end of the day, by the time you reach 3 or 4 o'clock, you start telling that, well, I've slept the whole night, but I still feel sleepy. I still feel that I'm not really happy with the way my body is responding to sleep, because sleep gives you rest. So why does it happen? Is because the eye is one of the only organ which is a little pampered compared to your heart. Heart can't say that I need rest. If heart says I need rest, then we'll have to rest in peace. Here, the eye has to always say that in different means. And lungs can't say I need rest. But the eye is the most pampered one because it does not really stop. Even if it stops, then you start. It gives you small clues. It gives you clues through irritation. It gives clues to stress. It gives clues to headache, and you start rubbing your eyes. So it is important that you have to consciously once in a while make your effort to blink. And that effort should come voluntarily when you feel that you're not doing it. And you're not doing it. The minute I talk about it, I start blinking. Otherwise, if you see this video, you'd probably not even see me blinking in a minute, maybe once or even less than that. For me, this is the biggest thing which can save your eyes from a lot of hazardous issues. It's like a cycle. I call it the vicious cycle. The reason vicious cycle is because if you don't blink, the tears are not, every time you blink, it's like this, you get tears are pumped. These are all the glands. Let's assume all my fingers are like glands, and you blink, it's pumped out, the tears are pumped out, and then it's the surface. So blink and open, blink, then your surface gets lubricated. This is the most important thing in today's generation, because whether you take a 2-year-old kid who uses screen time of more than 2 to 3 hours because parents feel that the child has to eat food. So that the child has to eat food, so you have to keep the computer on, you have to use the computer, you have to show the cartoons. So this is what is the challenging aspect of today, is a screen time starts as early as maybe 2 years or even earlier than that. So one thing which holds you happy and safe is when you try to voluntarily do this. The second thing which is important is how far do you sit. We have a tendency to go very close and sit. When we are seeing something exciting or when we see some work is exciting, we tend to be very close. We assume that coming close, we get more attached to the system. In fact, that is because more closer you go, all the hazardous effect of the light, you're putting more, more issue depth on more stress on your muscles. So what I do is always go one arm's distance. If this is your arm and this is your arm's distance is where you need to keep, depending on how long your arm is. So that is very important because that one arm's distance keeps you a safe distance because you're not doing something very close, nor you're doing too far. You're giving you enough space for the intermediate vision. And the third is that how do I rely? People ask me, how do I exercise? What exercise? It's not about building bodies, muscles. The best exercise is one is I told you the blinking. Second is your arm's distance. And third is about you look outside your window or object or anywhere around which is 20 feet away. Anything which is 20 feet away gives after every 20 seconds. Gives you that after every 20 minutes or gives you that relaxation of your muscles. For example, if your eye is like this, the muscles are like this. Every time you're working, so it has to go in and out, move in and out. This is how the muscles move, up, down, and when you have to read something, this is a muscle, they do this, they go close to you. And when you go to this, if you keep doing it for a long time, what happens when you push a muscle for a long time, it goes into a spasm. That means the muscles go into the spasm, and this spasm, only if you look outside at 20 feet away, it does this and it relaxes it. So again, you see object, it goes close, and you are observing some objects, you are seeing something. Again, after 20 minutes, you look outside, the muscles goes this and relaxes it. So this is why you need to break the cycle. Otherwise, what happens is some people have a tendency, it's the morning, they sit on a computer, this is your muscle, and this is what you see near object, it goes into, by the end of the day, the muscle does not relax. When the muscle does not relax, you have headache. This is because the muscle is at stress. If you exercise for a long time, your muscles goes into tremendous amount of stress, and that stress keeps it like this. You just cannot go in. So this stress, when you go home, you are irritable with your people at home. You become an irritable person. You are unhappy with everybody. Your child comes and asks you, you are angry with the child. You can't sleep. You get headache. And people think, okay, I have a lot of stress at work. Let me go and de-stress myself. People get into habits. They get into addictive to medicines, addictive to alcohol, cigarettes, because they want to reduce this, because the muscle does not go back. So, and many times when you go drive home, if the muscles are under stress like this, you are actually driving with a lot of stress because your muscles are not relaxing. If you don't muscles move, you cannot see the distance. When you don't see the distance, you see the light as halos. You see it's all around halos. It has everything you see has got a halo, and that is what is one of the major causes of accidents today, because you cannot judge objects. The reason is very important. That's why I'm stressing this. Is muscles have to move in and out. Only then it becomes. You cannot keep it like this. That means you cannot see the distance, and you can't see the distance, you get a judgment issues. This is very common in children. Children come home and say, Mom, I have a headache. I've got terrible headache, I just can't see anything. Parents think the child is lying. So make this as a point that give them, blink voluntarily, move your muscles. Remember this, my simple way of looking at it. Remember this, look outside so that you release it. This is the best exercise. This is what is going to change everything. This is my first point. The second point is by 2050, all of us will be wearing glasses like this. The 50% of the world's population will need a glass. By the age of 5 years, everybody will wear a glass. Today, the study shows that we are close to 28 to 31%. And by 2025, 2075, when our children becomes grandparents, or we become grandparents, I don't know, or little later, the world will not be seen without this. This is going to be, and this is a handicap. There are so many issues with the glasses. The issues with the glasses is that it gives you, it is not a perfect, it's God did not make us to wear this. He gave us this. It's because if you're wearing this, a lot of workplace, like you can't be a good sportsman, you can't swim, there are a lot of issues. So what do we do with this? There are a few things which is very important. One is, of course, because of COVID, the children are indoor now. I'm sure if you're looking at amount of increase in this from a child or adult, it's probably going to double, because more the indoors, more in these rooms, there's absolutely only computer and me. That's the connect we have. But one of the few things world is trying to do is spending at least 2 hours outdoors in a child can avoid this for a long time, especially if a child has a glass, or you are parents genetically have a glass and you are worried about your child getting it. You can't feed them carrots and cabbages and green vegetables. They're good for body, but they are little hyped for the eye. It cannot stop myopia. The best thing to do is make your child to play 2 hours outdoors. Make the child to play in sunlight. Expose the child to sunlight. The children are not exposed to sunlight. How does sunlight really help? Sunlight, when you go to the sunlight, it triggers in an hormones called dopamine. Dopamine is a hormone which helps in reducing the size or the length of an eyeball. If this is what the child's eyeball is, as the myopia increases, the eyeball keeps increasing. It keeps increasing. That's why the light rays doesn't come and hit on the retina. It hits here. And for when it hits here, you need a glass like this to make the light come here. So how do I make sure that this eyeball does not keep elongating? One of the best way to do to stop it from elongating is to expose to sunlight. So what does sunlight do? The dopamine helps in bringing those hormone changes, which prevents the eye from getting bulged out. So making the child 2 hours is a must. This is all from studies done in abroad, in Singapore and other places. And sunlight also has vitamin D. Vitamin D, I mean, this is not just for the people with glasses. This is for all of you. Today, one of the major problems with patients having dryness, brittle bones, tiredness, vague symptoms is having a low vitamin D. Vitamin D is a feel-good hormone. It is a vitamin, but it works like a hormone. So expose you to sunlight. Go out to the sunlight, sit down, and read a paper, read a week magazine, read an article by your favorite reporters. See, we have to go out, because if you don't expose yourself, it's not just your body, but your eye is also one of the major roles. I personally did work, and we published it, that the eye, the cornea, what you see, the black of eye, has basic receptors or the signals which can produce its own vitamin D. So why does God give receptors or signals which can produce its own vitamin D in the eye? It's because it has a role. It has a huge role in dry eye. And we published this work last year as a major journal. And we were one of the first teams to show that. So exposing yourself, make sure the vitamin does not get low. And there are recent reports from the COVID ICUs that patients who have low vitamin D are the ones who have more trouble recovering. So make sure that it's taken care of. Nutrition is very important, but we have to understand that nutrition is just not carrots and beans and green leafy vegetables. Nutrition is everything. Micronutrients are very important. For example, figure out which has more of zinc, which has more of lutein, zeaxanthins, which has more of vitamin D, E, and A's, and all of this. And then, make a diet plan. Especially works very well for people who are computer professionals. You need this to replenish the tear film. Omega-3 fatty acids are necessary. Instead of taking pills does not get absorbed well. Natural product does. If you don't fry it, you don't put it in oil and take care of it. All natural products have all this vitamin D, vitamin E, vitamin B12. All of them are very important. If you're a vegetarian, figure out what gives you vitamin B12. Because again, all this has an effect on the eye. Like I said, eye is a pampered organ. You have to pamper it. If you want it to work with you till the last day of your life, and you want to be in this world, the last day watching television or reading a paper, book, or a WhatsApp, when you turn 100, you need to take care of it. And that's why you need to be pampered. It needs to be pampered. Without pampering, it's not going to work. These food products, really, almonds, help a lot into this whole domain. Coming to the last part of my talk is all about this COVID times. COVID has two major issues at this point of time. One is the hand sanitizer. We all have a tendency to take a hand sanitizer and do this. What does it do? When it does that, if you go a slow motion, a lot of these things are splashing all over the place. And we do this all on the face. So what happens every time you do this splashes. If you take a very slow cameras, it splashes all over. This is chemical. This has got alcohol, ethanol, many components of this. On long run, of course, this is supposedly going to prevent us from COVID. Yes, it's important, but what about after a few years? These things can actually, if you're not. So whenever you're doing it, keep it away from your face, nose, mouth, eye. Very important organs. Keep it away, and keep it away in such a way that you don't do it. And have a habit of doing it like this. Doing it and not doing it very close, because you don't feel it, but everything goes inside. That fumes goes inside. So it is very important that we take care of it, because these are all chemicals. If it can kill a virus, it can kill a cell also. So they are known to kill a virus, but they are supposedly not safe if you don't take care of it. That's the most important thing. And the second is all about the mask. When you wear a mask, as a doctors, we wear these kind of masks, but every mask, you can have a different thing. So to wear a mask, these are the areas where your breathing happens. And when you wear a mask, you have to be very careful that if you're using it in a closed chambers, you have to be very careful about how you take care of your eyes. There are a lot of new reports, scientific reports, that wearing a mask like this blocks the breathing, and a lot of these things can have a change in your mask-associated dryness. There is something called as mask-associated ocular dryness, is something which has been published. So what do I recommend? People who wear masks and work on the computer, make sure that you at least use 5 to 6 times lubricating drops into your eyes. What lubricating drops? Each person has its own uniqueness. Whenever you get a time, it's good to visit a doctor or do an online chat with them and see what works best for you. Because mask-associated dryness is going to be a bigger problem in the working force. It can start with you, who is a professional, your child, and even a kindergarten kid, whose everything is becoming online. So it is very important that we take care of it. And a lot of work indoors now coming back to my same thing about the muscles. The muscles have become extremely weaker. So more the indoors we are, the muscles are getting weaker. So what we have to do is give them exercises, look at outside, so the muscles keep moving out, in, up, down, in, and so that these things can have a huge impact into the way you take care of it, and especially during this COVID time. To summarize, the one most important thing is to keep the 20-20-20 rule. What I mentioned, I gave you the examples of the muscles and how it moves. Second is expose your child to sunlight. More you sunlight, the child plays, dopamine comes in. Dopamine is good. Dopamine and all these hormones are very good, and they protect you. That's why sunlight and Surya Namaskar is a very, very important pillar of our Ayurvedic culture, is because when you do this, it is just not your body, but your mind and all the hormones come in. That's why Surya Namaskar is concept is based on these factors. The third is about whole myopia epidemic. I told you what you need to do. And then I spoke about the nutrition, the omega-3 fatty acids. And now it's very easy. You can Google it and you'll get what food to eat. And of course, green leafy vegetable, if you're into proteins, meat, vegetarians and non-vegetarians both have their meat plan laid out. But eating food and vitamins and omega-3 fatty acids and sunlight is very important combination of nutrition, not just carrots. And then finally, about the hand sanitizers, how you use it away from your face and keep it away from this, because sometimes we have become habitually we are abusing those hand sanitizers, and the mask, when you're using it for a longer time, you have a tendency for your rebreathed air, and all this can have a huge impact in your ocular surface. And I wish you all very safe and very prosperous, healthy life, from both from the eye perspective and the entire body. And I'm sure this COVID will go, but there are a lot of these things can be part of your healthy practice for the rest of your life. And you enjoy every part of your organ as given by God when you are born. Thank you.